Pastor Richardson. I know we all have a growing concern about the coronavirus and its spread in our nation and the globe and our immediate communities. But we can get through this if we use our best thinking and best practices. This week alone, we've seen the closing of schools, universities. We've seen the cancellations of major events, NBA, the National Hockey Association, the NCAA. We've seen Broadway shut down and St. Patrick's Day parade canceled. We've seen Disney World shut down. Just on and on the list goes. These are threatening times, the most difficult times we've seen in the 21st century. And I know that the threats and the uncertainty and the anxiety threatens to take us over. But I want to assure you that God is still on the throne and He will lead us through this. We must do all we can in our practices and in our faith to trust God. Together, we will get through this. As a result of what we are experiencing, we are limiting church activities as of today. We are limiting the activities to Wednesdays for prayer and Bible study and Sundays at 7:30, 9:30, and 11:30. Our governor has issued a statewide ban limiting the number of people who can gather to 500. So to be in compliance with the governor's mandate, we will restrict seating in our sanctuary to 500. We know that it is important that there is a space between people who gather. And therefore, we will also use overflow spaces, but we will be in compliance. More importantly, I want you to hear me. This virus can be very detrimental to our seniors, those with underlying conditions, those who have chronic illness. I want you to understand that this is a serious illness. And our seniors are extremely important to us. They mean so much. And I'm encouraging you, if you fall into this population of seniors or underlying illness or chronic illness, or even if you don't feel well, I'm encouraging you to take advantage and to worship with us on our live stream. Our live stream can be viewed at www.gracechurchtoday.org. It can be seen on Sundays at 9:30 and 11:30. You may tune in and worship with us. We want to stay connected during these difficult times. We've got to pull together and be a strong community. So stay in touch. Our deacons, our ministers, and our doctor's ministry join with me in being available to you during this difficult season. Together, we will get through this. Let me reiterate that we are reducing our activities to 2 items. One, at 6:30 prayer and 7 o'clock Bible study on Wednesday evenings. And second, we will be having our worship on Sunday morning at 7:30, 9:30, and 11:30. We encourage our ministries to continue meeting via Zoom or conference calls. It's important that we do everything we can to stay connected during these difficult challenges that we face. And now let me specifically focus on the details of the coronavirus. We're fortunate to have some of the best physicians in the world to be a part of the doctor's ministry of grace. Following this message, Dr. Suzette Oyeku-Jones will be sharing with you critical information that will help you to navigate during the threatening time of this virus. I hope that you will pay attention and that it will be helpful as you hear her share this important. Now to Dr. O.
Hello, my name is Dr. Suzette Oyeku-Jones from the Doctor's Ministry at Grace. Many of you have been listening to the news and have noticed the situation with novel coronavirus, otherwise known as COVID-19, has rapidly evolved over the past week. As of March 12, 2020, at 4 p.m., there are 325 cases of coronavirus in New York State. 148 of these cases are in Westchester County. 95 cases are actually in New York City, and this number will likely change. The Doctors Ministry here at Grace would like to share a few updates to keep you informed, healthy, and safe. Symptoms of coronavirus include fever, cough, shortness of breath, muscle aches, and in some people, they may actually have sore throat and upset stomach. How is the virus spread? The virus is thought to be spread mainly person to person. That's between people who are in close contact with one another within about 6 feet, through respiratory droplets that are produced when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Most people can be managed at home and do not require hospitalization. There is limited testing available through New York State and New York City labs. We anticipate that commercial labs will soon be able to start testing. At this time of the year, there are many reasons for someone to have cough and runny nose. This may also include having the flu, the common cold, and allergies. If you are sick, please call your doctor first before going to the doctor's office. If you do not have a doctor or you're not sure if you should call your doctor, you should call the New York State Coronavirus Hotline at 888-364-3065. You should avoid going to the emergency room or hospital except for significant illnesses or life-threatening emergencies. We are recommending this to prevent unnecessary exposure to viruses and other pathogens, as well as to prevent against overcrowding. The Centers of Disease Control and Prevention recommends that the best way to prevent illness is to avoid being exposed to this virus. Public health efforts to reduce the spread of the virus include social distancing efforts such as canceling large events, closing schools, quarantines, avoiding crowds, and working from home. Other ways that you can protect yourself from respiratory infections include washing your hands regularly with soap and water for at least 20 seconds. This means singing the happy birthday song at least twice. Use hand sanitizer that contains at least 60% alcohol if soap and water are not available. Avoid touching your eyes, nose, and mouth. Cover your coughs and sneezes and throw those tissues in the trash. Immediately wash your hands with soap and water for at least 20 seconds after throwing away the tissue. Disinfect frequently touched surfaces such as doorknobs, light switches, countertops regularly. Stay home when you are sick and avoid others who are sick. For individuals who are at higher risk for serious illnesses from COVID-19, such as older adults and individuals with chronic illnesses, you should do the following. When you go out in public, keep away from others who are sick. Limit close contact and wash your hands often. Take everyday precautions to keep space between yourself and others. Avoid crowds as much as possible. Stay home as much as possible to reduce your risk of being exposed. And avoid cruise travel and non-essential air travel. So what about these face masks? Wear a face mask if you're sick or when you're around other people, such as you're sharing a room or a vehicle, or before you enter a healthcare provider's office if you're able. If you are not sick, you do not need to wear a face mask right now unless you're caring for someone who is sick and they are not able to wear a face mask. Face masks are in short supply, and they should be saved for those individuals who are really sick, who are caregivers, and who are healthcare workers. We recognize that this constant news cycle about coronavirus can be worrisome and anxiety-provoking. We encourage you to obtain updates and information from reliable sources such as the Centers of Disease Control and Prevention, the New York State and New York City Departments of Health, as well as the Westchester Department of Health and the World Health Organization. Lastly, I also encourage you to remember to check in on your loved ones, including the elderly and those living with chronic health conditions. Check if they need food or water or any other supplies. Let's also continue to pray for God's hand of protection and for slowing down the spread of this virus. This is Dr. Suzette Oyeku Jones from the Doctors Ministry of Grace, encouraging you to wash your hands and to stay healthy this season. God bless.
Now, I want to assure you that we will get through this together. God bless you.